He was actually at work. He was having some chest discomforts. He was going to go home, called his wife. His wife's like, no, you have to go to the emergency room. I came down there, evaluated him. We realized that he was actively having a heart attack and that we knew that he needed advanced treatment options. There was an ambulance issue, and it was about 4 hours before we could get emergency transport, so we decided that we had to take him to the cath lab now to determine how bad this was. His family was there. They were all praying together. I stood back and I also bowed my head down, and when they said amen, I also prayed with them. So we knew that he needed more advanced options. Therefore, Kettering being a great cardiac center, it was decided that we needed to get him down there for the more advanced procedures. We called for a med-flight. Med-flight arrived very quickly, got him, picked him up, took him down to Kettering. He was to their catheterization lab within 30 to 40 minutes. So with the blockage that he was a great candidate for a stent. So with the stent, what they can do is they can pass a wire through the area that's blocked. It's a metal device that expands and it'll push the plaquing away, or to restore blood flow back into the coronary anatomy. And that prevented probably possible severe heart damage and would have improved his quality of life dramatically. If he had not gotten that, he could have had further heart damage and his quality of life could have been a lot worse. Well, if anybody's having any type of chest discomfort that's not going away, they should always seek medical attention. What we notice here in Shelby County and in Sydney is that when patients do come into the hospital, majority of them actually drive themselves to the hospital. If you truly are having a heart attack and you're having chest pressure, you're sweating, the best thing is to call 911 and have the emergency services actually come out to you. Heart screenings are great. The number one population will be diabetics. With diabetes, there's a higher risk for heart disease. If there's a very strong history of family heart disease, those patients also should be evaluated early to try to prevent and try to change their risk profile.